Good morning and thank you for joining us. Before we give our case update today, I'd like to introduce Jeff Kincaid, who's a management analyst at Lane County. He will be giving a brief update about our River Avenue facility, which you'll recall the county authorized purchase of in order to convert it into a space for COVID-19 respite. Jeff?
Thank you, Jason. Good morning. My name is Jeff Kincaid, and I am the Lane County lead on the 100 River Ave alternate care site efforts. I'm here today to provide you with an update on the significant progress made to date. On March 31st, the Lane County Board of Commissioners approved the purchase of the 100 River Ave site for $1.8 million for use in the response to the COVID-19 emergency. The facility is 18,388 square feet, sitting on approximately 1.55 acres south of Beltline Highway and east of River Road. It was last utilized as a Veterans Affairs clinic, but has been vacant for several years. Lane County has made significant strides toward preparing the facility since the board approved the purchase. Lane County partnered with Oregon Health Authority, FEMA, and the U.S. Army Corps of Engineers for an assessment of the property to identify improvements necessary to prepare the facility to operate as a non-acute alternate care site in response to COVID. The primary improvements identified were HVAC repairs and replacement, the addition of restrooms and showers to the east end of the facility, removal of all carpeting, and partitions to ensure appropriate separation between patients. The incident commander established an operations planning team to develop a plan for how the site will operate once complete, and established a procurement specialist to lead the effort to outfit the building for use. These efforts are being undertaken concurrently with the assessment, design, and construction efforts to ensure the facility will be ready to open very shortly after construction completes. Lane County requested assistance through the state and FEMA with construction management and oversight for the project. The Army Corps of Engineers was assigned to the mission on April 16th. Lane County closed on the purchase of the property and became the owner on April 17th. The Army Corps of Engineers contractor was on site for an initial walkthrough on Saturday, April 18th, and again with their design team and subcontractors on April 20th. Light demolition work, such as removal of carpet, began on April 21st. Work at the site continues today and will do so for the next few weeks. This is an excellent example of government working together at all levels, local, state, and federal, to achieve a common objective quickly and efficiently. The speed with which we have been able to accomplish so much so quickly is due to Oregon Health Authority's request to have the Army Corps of Engineers assess facilities throughout the state, the Army Corps' efforts in standing up teams, issuing requests for proposals, and establishing a list of capable contractors prior to projects commencing, and Lane County's decisive action to move forward. Lane County is thankful for the support of the state of Oregon, FEMA, and the Army Corps of Engineers. This project would not have been able to be completed on this time frame without their assistance. In particular, the Army Corps of Engineers team has displayed the utmost professionalism, dedication, and focus on this project. Their expertise and leadership have been invaluable to Lane County's efforts. Lane County looks forward to continuing this partnership and opening this facility for COVID response in the very near future. That is my update, and I will pass it back to Jason. Thank you.
Thank you, Jeff, and thank you to the team that Jeff leads. That has been a really impressive group of folks to watch work. They come in and work so efficiently and under such tight deadlines to really transform a space. It's been impressive to watch, so thank you again. I'd like to start off with a brief case update and move on to a few other messages. I'm happy to announce we are still at 48 cases. So this is the second day that we've been able to stand in front of you and announced no new cases. We do have 2,293, nearly 2,300 tests that have come from Lane County to our various labs, and that number is growing exponentially every day. We also remain at 1 individual hospitalized and 1 death. We have 21 individuals who have recovered and 25 people who are currently recovering at home but still sick. And a little update about our call center. We have noticed a pretty severe drop in the number of calls that are coming in, so we've decided to limit our hours. Starting this Saturday, we will be moving to 8 a.m. to 5 p.m. Monday through Saturday, and closed on Sundays. That'll offer a little bit of reprieve for our call center folks who have been doing such a good job answering, in the past hundreds of calls per day, and now as that slows down, allowing them to have a much needed break. So we are also announcing today, even though this is, the OHA has announced this yesterday, their new testing guidelines, which will significantly open up the capacity for testing and broaden the demographics of who we test. And so when we're looking at those numbers that are increasing every day, these guidelines and the relaxing of certain groups of individuals will help on that front. Finally, I'd like to hit on the importance of staying the course right now. As we know, we just announced no new cases, and so we are seeing that plateau really in effect right now, and that's something that we've been talking about now for about a month, sort of providing that context for our community of how this will look if we are able to abide by the physical distancing and abide by some of those respiratory hygiene pieces. And I'm happy to say that so far so good, that we have accomplished that, and that we are in what we would consider a flattened curve currently. However, in public health, different from, let's say, a forest fire or some other natural disaster, there's not that real tangible piece to track with. There isn't that physical manifestation of the crisis for us to look at and conquer. So what we're in right now is a maintenance phase, that we're sort of outlasting the virus through its incubation period. As you've seen reported, we have that 14-day incubation period. That's the time in which, from when a person is initially exposed to when they could potentially actually start to show symptoms and be considered to have COVID. And that can last anywhere from 2 to 3 days all the way up to 14 days. So it's really important that right now, even though we're seeing those low number of cases, that we maintain our physical distancing and we maintain the thinking behind where that physical distancing recommendation comes from. So we're trying to encourage the public to really look at some of the governor's orders and some of the other restrictions that have been placed, and maybe not concentrate on the letter of the law as much as really the ethos behind it as we start to relax guidance in May, as we look at opening up our businesses, as we look at going back to our parks and trying to have some semblance of normal life, that we keep in mind that public health is really most concerned about preventing the spread of the disease. And that comes from cutting off the supply chain of the virus. The supply chain, of course, being us and the transmission between people. So regardless of what happens, if we can continue that course of trying to stay at home as much as possible, trying to increase physical distancing between us and others, and really practicing good respiratory hygiene, that will help make sure that those few cases that we see in our community that we still have don't turn into more cases. And as we know, with the reproduction rate of COVID, that can happen very easily. So again, if we can sort of rally around that point of preventing the spread of the disease, regardless of what restrictions are in place, we'll be in a much better place. Now I will take any questions from members of the media.
Tom Adams with KVAL has a couple of questions. The first is, why is ordinance 2003 proposed if the county is close to having River Avenue?
So the question comes from Tom Adams at KVAL News. Why was the ordinance that the first reading just happened yesterday by the Board of County Commissioners, why is that being considered when River Avenue facility, which is meant to be a COVID respite, is up and running, or will be up and running shortly. So Tom, I think that's a wonderful question, and probably something that is on the minds of many people. So one of our public health strategies is to use hotel vouchers to help provide a respite space for individuals who are recovering from a number of different communicable illnesses. So we have folks who are recovering from tuberculosis. We have folks who are recovering from all manner of different reportable illnesses that we need space because those individuals don't have a home of their own. And they can't be around other people. Obviously, it's a communicable illness. So this is a strategy that we use in all times. And so what we are looking for right now is to make sure that we can continue that function unimpeded. And there is a time between right now and when River Avenue will be up and running that we have to consider. So those several weeks are important. And if we do get a case, we need a place for those individuals. Additionally, we are looking towards a second wave, and knowing that the River Avenue facility, while it'll be up and running, we do have other illnesses in our community where individuals may need respite. And so that function is vital for us to be able to carry out the public health elements that we need.
Next question from Tom. Are there protocols in the proposed ordinance to protect hotel staff from possible exposure?
So the next question from Tom at KVAL is, are there protocols in place within the ordinance to protect staff from COVID-19 exposure? So there are not protocols within the ordinance itself. That is something that, as I'm sure Tom and most people watching are aware, the recommendations around COVID change very quickly. So we want to actually codify that and put that into the ordinance. What we would do is work with hotel staff to both provide those resources in terms of guidance and also potentially make sure that they are equipped with PPE or anything else that would help them remain safe.
And last question from Tom. Does the proposed ordinance include fines for non-compliant hotels?
So the final question from Tom is, does the ordinance include fines from hotels? And yes, there is a $1,000 fine, I believe, for noncompliance from a hotel. And noncompliance would look like not accepting the voucher from the county for one of those patients.
Question from Chris Lunenberg at KZI. The White House says Oregon is in the bottom 4 states in testing. Is this accurate, and are the new OHA guidelines going to improve things?
So the question is from KZI, and they would like to know, the White House came out with sort of the rankings of states and their testing capacity and what tests they've done, and it showed Oregon being on the bottom 4, and whether or not we think that is accurate. So I think that the criteria which our federal government is using to make those rankings is accurate, of course. And our testing numbers have been low here in Oregon. Our guidance really has been to prioritize testing for those individuals with most severe illness, especially when those tests are going to our state public health lab. Now that guidance has changed, and with the addition of local testing options, we expect to see that change. So that's something that I think statewide we'll be working on, and certainly our focus here in Lane County, which I think we've identified hopefully for our public, and we can reiterate again. We want more testing. We want to have testing available to as many people as possible. That helps us not only track and identify the illness, but also help encourage people to follow the recommendations that we're making, having the knowledge of their own health status, which is an important piece to all of this, that we have to equip people with that piece of knowledge about their own level of health. So yes, I think that hopefully answers your question.
Question from Aubrey at KLCC. Do we anticipate case numbers might increase again with widening of the test guidelines?
So the question from Aubrey at KLCC is, with the expansion of the testing in general and also the relaxing of the testing guidelines, do we expect to see case numbers increase? So theoretically, yes, there could be an increase in testing in case numbers that would essentially just reflect what we already assume, that there are more cases in the community than what we're showing on our tests. And again, hopefully we've been very transparent and clear about that we do believe there's more illness in the community than what is being showed by those testing numbers. So with the expansion of testing, we would expect to see more of those tests. And really what we've used the testing numbers that we've announced every day is as a sample size, knowing that we won't ever, even with expanded testing, be able to have 100% accurate picture of everything that's happening in our community disease-wise, we can have a subsect of that population and be able to understand what's going on in this limited severe illness category. And so that's what we've been basing, and that's something that is done routinely in statistics, where you're able to look at a small percentage of an overall community and be able to draw inferences and conclusions based on that small number. But yes, to answer your question simply, we do expect to probably see more cases as a result of that expansion.
Question from Kelsey at KMTR. We're hearing nationally about concern over coronavirus returning in the winter. How is Lane County preparing for this?
So the question from Kelsey at KMTR is, we're hearing concern from reports nationwide that there may be a second wave of coronavirus, and it could sort of sync with flu season in those winter months. And so that is something that I think that thankfully our health officer, Dr. Patrick Ludke, has warned us about from the onset of our response, and that much of what we're doing really is not just about this current outbreak, but also looking forward to that possibility of a second wave, and making sure that we are putting systems into place to be able to react proactively and in a much quicker capacity on that second wave. So things like River Avenue, which Jeff just filled us in on, are very key and strategic to having those resources available. I also think that what we're doing right now with our data tracking and also the lessons learned on what's working, what's not working, are going to play a huge role going forward and looking at that second wave on how we react, and making sure that whatever we're doing really is accomplishing our goal of spreading or slowing the spread of COVID-19. And that's all we have. Thank you for joining us.